Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now let's understand the pulmonary embolism findings. So we are looking at the pulmonary embolism findings, chest X-ray findings. So firstly, there is a Westermarck sign. So there is Westermarck sign. So the Westermarck sign is nothing but a focal area of the oligemium. So it is a focal area of oligemium, and it has a decreased vascular marking that is distal to the embolism. Distal to the embolism. So focal area of oligemia, which is nothing but decreased vascular marking with distal to the embolism. Next, let's move on to the Hampton's hump. So there is something known as Hampton's hump. So this Hampton's hump is nothing but a peripherally placed wedge-shaped or a dome-shaped opacity which is due to the infarction of the lungs. So it can be peripherally placed wedge-shaped, or is also known as dome-shaped opacity due to the infarction of the lung tissue. It's opacity, and this is due to the infarction of the lung tissue. Next is we look at something known as a Pala sign. So what is meant by Pala sign? Pala sign is an increased in the size of the right descending pulmonary artery with its sausage-like appearance. So it is increase in the right descending pulmonary artery. Right descending pulmonary artery. So it is increase in the right descending pulmonary artery, and it has a sausage-like appearance. So there is sausage-like appearance. Next, moving on to the Fleischner sign. So Pala sign is nothing but the increase in the right descending pulmonary artery, which is sausage-like appearance. Next, we move on to something known as a Fleischner sign. So this Fleischner sign is enlarged pulmonary artery. Fleischner sign is nothing but enlarged pulmonary artery. Enlarged pulmonary artery. And next is something known as the melting sign. So what happens in the melting sign? Melting sign is in fact shows a rapid clearing in contrast to the pneumonic consolidation. So it is nothing but an infarct. It is nothing but an infarct, shows a rapid clearing in contrast. Infarct shows rapid clearing. Rapid clearing in the contrast to the pneumonic consolidation. Next, we look at the McConnell sign. So what's happening in case of McConnell sign? So the McConnell sign is nothing but an indirect sign of the PE seen in the transthoracic echo. So it is nothing but an indirect sign seen of the pulmonary embolism. It is seen in the transthoracic echo. And there is hypokinesis of the right ventricular free wall with the normal motion of the right ventricular apex. So there is hypokinesis. Hypokinesis. So hypokinesis is seen in right border of the ventricle, right ventricular free wall. So hypokinesis in the right ventricular free wall, and there is a normal motion of the right ventricular apex. Right ventricular apex. Next, let's understand the knuckle of the sausage sign. So let's understand the knuckle or the sausage sign. So knuckle of the sausage sign is a dilation of the pulmonary artery, the proximal to the embolus, with the collapse of constriction of the distal arteries, resulting in an abrupt tapering of the arteries. So in short, it is a dilation of the pulmonary arteries. So there it is proximal to the embolus, with there's a collapse or constriction of the distal arteries. This collapse or constriction of the distal arteries, resulting in an abrupt tapering of the arteries. So there is abrupt tapering. So there is tapering of arteries. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.